Hello, welcome everyone. Today we are going to discuss about the health and social care context and principles. And we are going to discuss the learning outcome 3, which is understand legal responsibilities in adult and social care. So I'll begin my session. So uh, welcome to our session on understanding legal responsibilities in adult social care. Today, we will discuss the laws and regulations that shape our practices and ensure that the rights and safety of those in our care are protected. So, what are the important points in that? Uh, the CARE Act 2014 is an important legislation in uh, understanding the legal responsibilities in adult social care, and it's related with the health and social care context and practices. So, the CARE Act 2014 sets out the duties and responsibilities of local authorities in providing care and support to adults. It emphasizes the importance of personalization in care, ensuring that service meet the specific needs of individual. Personalization is a key, and the Act also introduces assessment for carers, ensuring their needs are considered alongside those the care for alongside those they care for. And there's Mental Capacity Act as well. This is an important act as well. That is the Mental Capacity Act 2005. This act is crucial for protecting the rights of adults who may not have the capacity to make certain decisions for themselves. Why understanding this act is important in social care? Because it helps care workers ensures that any decision made on behalf of someone lacking capacity are made in their best interest, and it provides legal uh, guidelines for those like who are practicing or who are working in the health and social care, and the guidelines for how these decisions should be made, it often involving an advocate. The Act also introduces the concept of least restrictive options and requires that any intervention respects the person's right and freedom as much as possible. We also have Health and Social Care Act 2008. This act is significant for establishment of the Care Quality Commission, which we normally call as CQC, and the CQC regulates all health and adult social care services in England to ensure they meet fundamental standards of quality and safety. It conducts inspections and can enforce penalties if its standards are not met. Regulation by the CQC is a key part of maintaining high standards in care, and we have Equality Act as well, which is Equality Act 2010. This act protects individuals from discrimination in care setting and society at large. Why is anti-discrimination important in social care? Because it ensures that everyone, regardless of their race, religion, gender, disability, or sexual orientation, receive the same level of care and respect, promoting inclusivity and fairness in care settings. Equality and respect for diversity are fundamental to ethical care. And we also have Data Protection Act 2018, which is integral in the context of GDPR. And it regulates how personal information is used and protected, ensuring that care providers handle sensitive data responsibly and with confidentiality, which is crucial for building trust with service user. Data protection is essential for maintaining the privacy and dignity of those in care. So this is all about our uh, topic today, the important points. If you have any questions, then please do let me know and ask the questions, and I'll try to answer those questions and queries regarding the health and social care context and principle, and especially with the learning outcome 3, which is understand legal responsibilities in adult social care. Now for the slide 2, we have the indicative content, and we have the legal responsibilities and relevant legislation. Right. So few of the legislation I have discussed in the beginning uh, with the first slide, the title of the slide. So we will discuss more about the other responsibilities and relevant legislation. So here we have CARE Act 2014. So as I said before that uh, this legislation is foundational in setting out the duties of local authorities concerning the care and support of adults. And if I ask, like, or if I define the concept of well-being as introduced by the CARE Act. So, well-being involves considering various personal aspects, including physical, mental, and emotional health, as well as social and economic well-being. So, well-being is really very important in health and social care industry. It is a holistic approach. Now, if we move to the equality and human rights, the Equality Act 2010 ensures that services are provided without discrimination. It ensures that all individuals receive equitable treatment regardless of their background, promoting inclusivity and protecting against discrimination. Now, the next bit is confidentiality. Um, This is crucial in maintaining trust and privacy. It involves legal mandated obligations to protect personal information unless disclosure is required by law. Then we have duty of care. So, a duty of care means we must do all we can do to keep the people we care for safe and well. Confidentiality is part of this as it protects individual privacy and support their safety. Now, what we have duty of candor. So, this duty requires providers to be open and transparent with clients or service user about their care, especially when things go wrong. And why this is important? It builds trust and ensures accountability, fostering an open environment where mistakes can be learned from and improvements made. Next bit is health and safety. Uh, like health and safety are crucial in preventing harm in care setting, and what they do is they ensure that the environment is safe for both residents and staff, requiring risk assessment and appropriate measures to mitigate risk. Now, what we have mental health. Okay, um, mental health or mental health capacity. Uh, it's governed by the Mental Capacity Act 2005. This act provides a framework for making decisions on behalf of people who lack the capacity to make decision for themselves. And if we ask about the key principles, so one key principle is that any decision made must be done with the least restrictive option to the individual basic rights and freedom. So additionally, safeguarding is integral to our roles involving protection from abuse and neglect. Now, okay. Okay, in safeguarding, it involves monitoring, reporting, and addressing any concerns of abuse or neglect, ensuring that vulnerable adults are protected. So, and the last bit is we have mental health. The Mental Health Act is crucial piece of legislation. So why it is important in social care? It provides guidelines for assessment and treatment of individual with mental health condition and often involving care under specific circumstances that respect their rights and ensure safety. So this is about all the bullet points, all the 9 bullet points of legal responsibilities and relevant legislation. Then we have uh, rights of service user. Okay, so we are going to discuss the rights of service user within health and social care. It's an essential part of ensuring ethical and effective care. So, to be treated fairly and equally, this principle is rooted in the Equality Act 2010, and this right ensures that no person receives less favorable treatment due to their race, gender, disability, religion, or any other status. It promotes inclusivity and dignity in care, which is fundamental to their well-being. Treating everyone with respect and equality is the cornerstone of ethical care. Next, we have the right to health and social care within the national context. So, which is influenced by various pieces of legislation, including CARE Act 2014. This right ensures that every individual has access to care and support necessary for their well-being. How does this affect our responsibilities as case provider? It means we must ensure that care services are accessible to all who need them and that these services meet the required standard to support the health and well-being of individual effectively. Now, this brings us to the third point, which is the relevant legislation and standard. So this includes human rights legislation like the Human Rights Act 1998, which incorporates the European Convention on Human Rights into UK law. This legislation underpins rights such as respect for private and family life and the right to live. How do these rights impact our care practices? These rights require that care practices not only respect the physical needs of service user but also their privacy, dignity, and personal relationships. It impacts how we plan and deliver care, ensuring we consider the service user's preferences and needs. Respecting these rights is integral to our legal and ethical obligation towards service user. Another vital aspect is the standards set by the regulatory bodies such as the Care Quality Commission, CQC in England. These standards ensure that the rights of service user are upheld in practice and they provide a framework for what good care should look like and set minimum requirements for care providers, ensuring that the service user receives safe, effective, compassionate, and high quality care. Standards and inspections by bodies like CQC help maintain the quality of care and uphold providers accountable. So this is all about this slide. Then we have slide 4. Information is missing from here about the key terminology, but we have discussed all the important aspects or the terminologies. In slide 5, we have a video to watch. I think the link is missing. So we'll go to the next slide. In the meanwhile, if you have any question, then please ask me. Then I'll try my best to answer. Now we have explain the legal responsibilities in adult social care. So they're talking about the care legislation and the Care Act. Okay. So we have mentioned the Care Act 2014 previously, which is a cornerstone in UK care legislation. And what it does, it sets standard for the assessment and provision of care, ensuring that local authorities have clear duties towards adults in need. This act also emphasizes the importance of safeguarding and promoting well-being. Safeguarding again refers to protecting adults' right or anyone to live in a safe environment free from abuse and neglect. And it also involves taking appropriate measure to prevent harm as well as promoting the welfare of the service user or any human being. Safeguarding is also a critical aspects of Care Act. Now let's move on to the other important pieces of legislation. So we have equality and human rights. So Under the Equality Act 2010, it is essential that services are delivered without discrimination. This act protects individuals from discrimination based on protected characteristics such as age, disability, gender, race, religion, or belief, sex, and sexual orientation. Additionally, the Human Rights Act 1998 ensures fundamental rights are protected, such as the right to life, freedom from torture, and inhuman or degrading treatment, and the right to respect for private and family life. Then we have confidentiality and data protection. Uh, right. So, legal responsibilities include promoting personal information under the Data Protection Act 2018 and GDPR. Care providers must ensure that information is handled securely and confidentially. Why it is important in social care? Because service users often share sensitive personal information that, if mishandled, could lead to significant harm or distress. Maintaining confidentiality builds trust between service provider and users. Right. Okay. Then duty of care. Uh, this legal obligation requires that all social care workers act in the best interest of those they care for, ensuring that no harm comes from them through action or inaction. It encompasses everything from providing adequate attention and making safe decisions to ensuring professional behavior and competence. Now, what we have next, equality and human rights and confidentiality. Okay, so if we discuss about equality and human rights, so this area is primarily governed by the Equality Act 2010 and the Human Rights Act 1998. So we discuss about these that the Human Rights Act and the Equality Act 2010 is really important, and like it safeguard the fundamental human rights, and these protections are crucial for fostering an inclusive environment where all service users feel valued and respected. This not only improves the quality of care but also enhances the well-being of service user. Okay. Now, if we talk about some specific measures care provider can take to uphold these principles, and what would be the some practical steps. So, training staff on diversity and inclusion, implementing non-discriminatory practices in service delivery, and ensuring all policies and procedures respect individual rights and freedom. It is also important for providers to regularly review their policies and training to adopt evolving understanding and laws concerning equality and human rights. Now, moving on to confidentiality. This is another cornerstone of legal responsibilities in social or healthcare. Why is confidentiality particularly significant in this field? Because service users often share personal and sensitive information that, if again disclosed improperly, could lead to harm or distress. Because trust is the foundation of effective care. Care provider must ensure that information is stored securely and that access is controlled strictly. Confidential information should only be shared with consent from the service user or lawfully when required, such as in cases where there are safeguarding concerns. Uh, and again, what are some of the best practices for it? Using secure system for strong storing personal data, training staff on data protection principles, and having clear policies on how information is shared within and outside the organization. Okay. What we have, duty of care. Uh, This duty of care is a fundamental aspect of social care, health and social care practice, requiring providers to take responsible steps to ensure that the safety and well-being of service user. And it is about being proactive in preventing harm and ensuring an environment that promotes well-being. Okay, if we consider a scenario where a care worker notices that safety protocols are not being followed, what should their response be under the duty of care? It should be the care worker should report the issue to their supervisor immediately to address the risk and prevent potential harm. They should also document the issue and any actions taken as part of maintaining accountability. So it's crucial that care workers not only follow protocols but also act as advocates for safety within their roles. Now we have duty of candor. So this duty is about openness, particularly in instances where care does not go as planned. So why it is important? Because it builds trust between service user and care provider. Being open about mistakes allows for learning and improvement in care practices. And it ensures that service user and their families are treated with respect and dignity even when things go wrong. Under the duty of candor, what steps should the care provider take? The provider should inform the service user and their family about the error, apologize, and explain the consequences and the steps being taken to address the error and prevent future occurrences. They should also document the incident thoroughly. And these are the important points. So go to the next slide. In this, we have Health and Safety and Mental Capacity Act. So we discussed this earlier, but in this slide, we will discuss it again. Health and safety, it's a broad area again that includes everything from physical safety measures to ensuring psychological well-being, and uh, there should be some compliance with health and safety regulations. So it is crucial in healthcare setting. Uh, why it is important? Because it ensure a safe environment for service users, staff, and visitors. This reduces the risk of accidents and injuries and promotes a culture of safety that have that provides safety to all of the staff, service user, or visitors, anyone. So now we also have part of maintaining the safe environment. It also involves regular risk assessment. Risk assessment help identify potential hazard and implement control measures. And like for control measures, what could be included in control measures? Control measures can include proper staff training, using safety equipment, ensuring that the physical environment is free of hazard, and having emergency procedures in place. Effective training and supervision are the backbones of implementing these safety measures successfully. Now we'll talk about mental capacity. Governed by the Mental Capacity Act 2005, this act provides a framework for decision making on behalf of adults who may not have the capacity to make certain decisions for themselves. Uh, and one key principle is that an individual is assumed to have capacity unless it's established otherwise. Another is that any act done or decision made under the act for or on behalf of a person who lacks capacity must be done in their best interest. And a provider might need to make decision when an individual lacks the capacity to consent to medical treatment, manage their financial affairs, or make decision about their living arrangement. This is about the Mental Capacity Act 2005. Then we have uh, safeguarding. Okay. Safeguarding refers to protecting adults who may be at risk of abuse, neglect, or harm. It involves taking appropriate measures to prevent abuse and responding effectively when concerns are raised. Safeguarding is about prevention and protection. Now, care providers have specific legal duties under laws such as the Care Act 2014 in the United Kingdom. One key duty is to identify safeguarding concern. This can involve recognizing signs of abuse or neglect, which might be physical, emotional, or otherwise. What are the some signs that might alert a care provider to a safeguarding issue? For example, signs can include unexplained um, injuries, signs of malnutrition, fearfulness around certain individual, or certain changes in behavior. Like identifying these signals early is crucial. After identification, the next step is responding to safeguarding concern. What it involves reporting the concern to the appropriate authorities and like why timely reporting of any safeguarding issue or concern is important. Timely reporting ensures that the individual receives necessary protection and support promptly. It also allows authorities to investigate and intervene as needed to prevent future harm. Now, all care providers should have safeguarding policies and procedures in place. These policies guide the actions of the staff and ensure a standardized response to safeguarding issues. These policies typically include guidelines on how to report concerns, steps to take when abuse is suspected, and how to support the victim. They also detail the responsibilities of the staff and the procedures for training and awareness. Effective safeguarding policies are not just about reacting to incidents, they also include preventive measures such as staff training and awareness program. So this is about the safeguarding. Okay, now we have the conclusion. Understanding these legal responsibilities is essential for ensuring compliance with the relevant laws and regulations, promoting the rights and well-being of service users, and maintaining high standards of care and professionalism within the adult social care sector. So now we'll move to the next slide. The next slide, we have to analyze the rights of service user in adult social care. So we have two important points here, rights to fair and equal treatment and rights to health and social care. So as we have discussed, service user in adult social care have fundamental rights that must be upheld by providers. And after examining the rights to fair and equal treatment and to the health and social care, we'll move to the rights to privacy and confidentiality. Service users have the right to privacy and confidentiality in all aspects of their care. This includes the right to have personal information protected and to be consulted about how their information is used. This right is supported by legislation such as the Data Protection Act 2018 and GDPR in the context of storing and handling personal data. Privacy and confidentiality are crucial because they protect the dignity of individual and ensure that their personal and sensitive information is not misused or disclosed without consent, which could lead to harm or distress. Then we have right to autonomy and self-determination. This right empowers service users to make their own decision regarding their care and daily living. This includes the right to make choices about how they are treated, where they live, and with whom they interact, as long as these choices do not harm others. This is particularly emphasized in the Mental Capacity Act 2005, which provide framework for supporting individuals who lack the capacity to make certain decisions. Now, right to participate in the community. Uh, okay, so service users have the right to participate in social activities and be part of the community regardless of their disabilities or care needs. This includes the right to access public places, social events, and educational or vocational activities. Social inclusion is vital for promoting mental health and emotional well-being. And this is, I think, all the important points. Then we'll move to the next slide. So in the next slide, we have human rights, citation, informed consent, and confidentiality and privacy. So we are focusing on some fundamental aspects that protect the dignity and rights of individual in adult social care, health or social care. So human rights, citation, informed consent, and confidentiality and privacy. So the first one is the human rights citation. So again, the Human Rights Act 1998 the Act embeds the protection of the European Convention on Human Rights into UK law. Key rights under that act that affect adult social care include the right to life, freedom from torture and inhuman or degrading treatment, and the right to respect for private and family life. So why this is important that these rights are maintained in health and social care setting? Maintaining these rights ensure that individuals in care are treated with dignity and respect, which are the fundamental rights to their well-being and quality of life. So now moving on to informed consent. This is a critical area where the legal and ethical obligations of care providers intersect. Informed consent means that care must not be administered without the clear and voluntary agreement of the service user, who must understand the nature of the care being proposed. So, what does the process typically involve? It involves providing the service user with all relevant information about the treatment or intervention, including potential risks and benefits in a way that they can understand. And this may require the use of simple language, interpreters, or visual aids. The service user must then give in consent freely without correction. Then we have confidentiality and privacy. These are both crucial in building and maintaining trust between service user and care providers. So how should a care provider handle personal information? So care provider must ensure that personal information is stored securely and only shared with individuals who have a legitimate need to know as part of the care team, and only with the service user consent unless there are overriding legal reasons such as risk of harm or abuse. Right. Then we have choice of control, protection from harm and abuse, complaint, and redress. Okay. So choice and control. This right emphasizes the importance of respecting service user and autonomy over their own lives. This includes decision about daily routine, social activities, and living arrangements. Promoting choice and control is crucial because it respects the individual right and support their dignity and independence. Then we have protection from harm and abuse. Uh, this right is foundational to the trust that must exist between service user and providers. Providers are legally required to safeguard adults from abuse and neglect. This includes implementing effective measures to prevent harm, training staff to recognize signs of abuse, and reporting swiftly and appropriately to any safeguarding concern that arise. Then complaints and redress. So this right ensures that service user can voice concerns about their care. What should an effective complaint procedure include? An effective complaint procedure should be easily accessible and well communicated to all service users and their families. It should outline the steps of making a complaint, timeline for responses, and assure users that their complaints will be handled fairly and without any repercussion. So this is about it. Then what we have. Okay, now we have the conclusion. And in the conclusion, it's mentioned that analyzing the rights of service user in adult social care involves ensuring that legal and ethical principles are upheld and that individuals are treated with dignity, respect, and compassion in care setting. It also involves identifying barriers to the realization of these rights and advocating for policies and practices that promote rights and well-being of service users within the adult social care sector. So we discussed everything in the conclusion from the earlier slides. Now we'll move to the next slide, and which is assess how legal responsibility supports the rights of service user in adult social care. So we have to talk about a legislative framework, and it has again some frameworks or the laws or the legislation which we have discussed earlier. Okay, so legislative framework will focus on key legislation in that, so such as the Care Act 2014, the Mental Capacity Act 2005, and the Human Rights Act 1998. So what are the primary objectives of Care Act 2014? The Care Act 2014 primarily aims to enhance the well-being of individuals requiring care and support, ensuring that their needs are met effectively. It emphasizes the importance of personalizing care services, safeguarding adults from abuse and neglect, and ensuring that decisions about care are made with the individual's involvement. Then, for the Mental Capacity Act 2005, this act is vital for upholding the autonomy of individuals who may lack the capacity to make certain decisions for themselves. Then, if we talk about the Human Rights Act 1998, so again, it incorporates the European Convention on Human Rights into UK law. The Human Rights Act ensures that the fundamental rights, such as the right to live or freedom from inhumane treatment and respect for private and family life, are protected. So then now let's analyze the specific provisions. Within these legislation, for instance, the CARE Act requires that local authorities conduct need assessment and provide information and advice. So to this is all about it, and we'll go to the next slide. Rights-based approach and safeguarding provision. Okay, so right-based approach, and this approach frames legal responsibilities within the broader context of human rights. Now we'll discuss how the Human Rights Act 1998 and the Equality Act 2010 contribute to a right-based approach in health and social care. The Human Rights Act 1998 incorporates European Convention on Human Rights into UK law, and the Equality Act 2010 ensures protection against discrimination based on various characteristics, promoting equality. Both laws help frame care in the context of respecting and promoting human dignity and equality. These laws provide legal framework that supports the rights of individuals, ensuring that care services respect and enhance their dignity and autonomy. So practices like involving service user in care planning, providing access to advocacy, and ensuring services are accessible to all individuals regardless of their background are good examples. Now we have to discuss safeguarding provisions. Safeguarding is about protecting individuals from abuse and harm. When evaluating safeguarding provision, there are some key elements we should consider to assess the effectiveness. We should consider how clearly the laws define abuse and the responsibilities of care providers. Additionally, the robustness of reporting obligation and investigation procedure, as well as how accessible these procedures are to both care provision and service users, are crucial. So, this is all important for these right-based approach and safeguarding provision. Move to the next slide. In the next slide, we have consent and decision making and confidentiality and privacy. So, consent and decision making. This area is fundamentally about respecting service user rights to autonomy and self-discrimination. And the Mental Capacity Act 2005 is crucial because it provides a legal framework for supporting decision making for individuals who may lack the capacity to make certain decisions for themselves. And the care provider should first try to communicate with the service user in different ways to maximize their participation. If it's clear they lack capacity, the decision should then be made in their best interest, considering their past and present wishes, feelings, beliefs, and values. We will do the assessment for this, and then we have to discuss about confidentiality and privacy. Uh, Again, this area deals with how personal information is handled within care setting. Confidentiality and privacy are important because they protect the dignity and personal rights of service user. They are legally protected by laws such as the Data Protection Act 2018 and GDPR. These laws provide safeguards that require any personal data, including health information, to be handled in ways that ensure security and respect for privacy. And if we ask that what challenges might arise in maintaining confidentiality and privacy and how can they be addressed? So challenges can include like data breaches or excessive sharing of information among care teams. These can be addressed by regular training on data protection laws for all staff, implementing robust data security measures, and maintaining clear policies on who can access the information and what or which information they can access. Then we have complaints and redress mechanism, monitoring, and oversight. Okay, we have discussed that before, but now we have to uh, discuss about the mechanism. So we are going to examine how legal frameworks support service user in raising complaints and seeking redress, as well as the role of regulatory bodies in ensuring compliance with these legal responsibilities. So the first one is the legal framework in adult social care often includes specific provision for handling complaints. What are some key features that make a complaint procedure effective? An effective complaint procedure should be easily accessible, meaning that the information on how to make a complaint is clear and available to all service users. It should be transparent with clear steps outlined and responsive, ensuring timely acknowledgement and resolution of complaints. Accessibility, transparency, and responsiveness are crucial. Now consider the CARE Act 2014, which mandates local authorities to have clear procedures for handling complaints. And how do we assess the effectiveness of such legal requirements in practice? The effectiveness can be measured by the speed and fairness with which complaints are resolved. It involves monitoring outcomes to ensure that complaints lead to meaningful actions that prevent reoccurrence. However, challenges might include underreporting due to lack of awareness or fear or retaliation among service users. Now, monitoring and oversight. Regulatory bodies like the Care Quality Commission, CQC in the UK, again play a vital here, and like the CQC are responsible for inspecting care providers to ensure they meet legal and quality standards. They assess how well the care is being delivered, focusing on safety, effectiveness, and the respect of service user right. They also enforces action when providers fail to meet standards. The oversight function are critical for maintaining trust in the care system, and effectiveness can be assessed through the frequency and thoroughness of inspection, the transparency of the findings, and the impact of enforcement actions on improving service quality. It's also important that these bodies are independent and adequately resourced to perform their duties effectively. Intersectionality and equality. Okay, so in the context of adult social care, addressing the intersecting needs and rights of diverse service user uh, population is crucial for ensuring equality and inclusivity. Legal responsibilities play a significant role in promoting these principles and addressing disparities that may exist among different groups. So, how we can assess the impact of legal responsibilities in this regard? So, first we will discuss about the equality and non-discrimination. Evaluate whether legislation especially prohibit discrimination based on factors such as age, gender, ethnicity, disability, or socioeconomic status. We need to consider whether there are specific provisions that promotes equal access to care services and prevent discriminatory practices. Then we'll discuss about inclusivity and accessibility. Uh, okay. So, uh, whether legal responsibilities include measures to ensure that care services are accessible to all individuals, including those with disabilities or from marginalized background. This may involve provision for reasonable accommodation, language interpretation services, or culturally sensitive care practice. Then intersectional approach. Uh, we need to consider whether legislation adopts an intersectional approach, recognizing that individuals may face multiple forms of discrimination or disadvantages. We need to evaluate whether there are specific provisions that addresses the unique needs and rights of individuals with intersecting identities. We need to do the promotion of diversity. Uh, we need to evaluate whether legislation promote diversity within the adult social care workforce and services. We need to consider whether there are provisions that encourage cultural competency training, recruitment of staff from diverse backgrounds, and inclusive service delivery models. Then we can monitor. We can assess whether there are mechanisms in place to monitor and evaluate the impact of legal responsibilities or promoting equality and inclusivity. So these are the important point in this. Then we have the conclusion. By systematically assessing how legal responsibilities support the rights of service users in adult social care, stakeholders can identify strength gaps and areas for improvement in legal framework and regulatory practices. This assessment can inform policy development, training initiatives, and quality improvement efforts aimed at enhancing the rights, dignity, and well-being of individuals receiving care within the adult social care sector. So we covered all these in the previous slides. Mm, Okay, so now this is the end of the slides. So what we did in that, so uh, in conclusion, understanding legal responsibilities in adult social care is essential for ensuring that service users' rights are protected and upheld. So important legislation such as the Care Act 2014, the Mental Capacity Act 2005, the Human Rights Act 1998. They all provide a framework for promoting equality, autonomy, dignity, and safety for individuals receiving care. So, by assessing how legal responsibilities support service user right, we can identify areas for improvement and ensure that care provision is person-centered, respectful, and effective. So, person-centered care is also very important because we make the care plan based on the assessment and which is like important for the well-being of the service user. It should be person-centered. So, um, if as we conclude this lecture, it is important to recognize the complexity and importance of legal responsibilities in adult social care. By upholding these responsibilities and promoting the rights of service user, we can contribute to creating a society that values and respects the dignity and autonomy of all individuals, regardless of their circumstances. So this is all from me for today. Uh, Anyone have any question regarding today's slides or lesson or lecture? Any question, students? One important thing is that when you write your assignments, so make sure that whenever you are mentioning any law, legislation, or any important act, so make sure that you write it completely. Like if you are mentioning about, for example, Human Rights Act, so always mention Human Rights Act 1998. If you are mentioning about the Care Act, so you can mention it completely like the Care Act 2014, and always use the exact command verbs in your assignment or the headings, like whatever command verbs are there in your um, assessment criteria, use exactly the same command words. And we need to figure out and we need to find out the key key terms or the key points or the keywords, and then we need to do the assessment accordingly, considering the command verbs. Any questions, students? No questions. Okay, and like here, for example, we have the references in this slide. So we need to make sure that the references are Harvard referencing. Make sure we all follow the Harvard referencing format in in our assignments. And we also have to do the in-text citation. And the in-text citation should also be in the Harvard referencing style. And we need to give reference, or we need to, like, we can say that we always need to provide uh, it's ethically correct as well. We need to give credit to the original author of the content, and then because we are rewriting it in our own words, we are paraphrasing it, so we need to give the credit to the author. And so that's why we uh, do the referencing and the in-text citation. And we always follow the Harvard referencing style in our assignments in the health and social care field, but it depends upon the university and the requirements of the um, of the authority which we are dealing with, and the certification which we are getting from. So that's why, like, we need to follow the standards as set by the awarding body. So always, like, read your assignment brief properly And if there are some instructions about the font size or the uh, which font to be used specifically, or like what should be the uh, space between the lines, so we need to follow. And sometimes like there are some requirements like it should be a booklet, the work should be in a form of a booklet, so we will make it in a booklet format. Or there would be like a requirement to make a PowerPoint presentation, so we will then use the Microsoft PowerPoint. And if it's a written work, then we'll use the Microsoft Word. Or like if we have any data to interpret, then we may use, for example, Microsoft Excel for that. So we always need to read the uh, assignment brief properly and understand what are the assessment requirement and what are the criteria, and what are the command verbs and what are the keywords that we need to answer. And always like we have to use the command verbs in there, or command verbs or the words in our assignment exactly as they are mentioned in the assignment brief. So in order to pass, like we always need to follow the pass criteria. Then we need to like just if you want to get the merit or distinction, then first we need to achieve the passing criteria, then we will move to the merit criteria, then we will do the work for the distinction criteria. So if we don't achieve the passing criteria, whether we have wrote about the merit or distinction criteria, then we won't get a pass grade. So it's a must that first we need to achieve the passing criteria or the passing grade, and then we will move on to the merit or distinction criteria. So if we talk about holistically, then sometime like we can say that okay, the student overall has achieved holistically passing criteria, but it's the best advice that always try to achieve first the pre-criteria, the passing criteria, then work on the merit criteria, then work on the distinction criteria. So this is all. These all are the important points which I remembered so far. So I thought to tell you about these. Any questions? Any questions, student? If you have any question, then please like ask me any question. We'll discuss. I think there's no question for today. So then I will finish my lecture, and I can say that thank you for your attention, and I encourage all of you to continue exploring these important issues and in your studies and professional practice as well, because our students, they are practicing in the health and social care industry. So we need to make sure that we always follow the uh, organizational policy, national policies, and all we follow all the uh, legal responsibilities, legal requirements, the legislation acts we need to follow. So that's all for today. Take care, everyone, and bye.
Bye.
Bye.